Malaria is highly endemic in Nigeria. It poses a major challenge to the country as it remains one of the leading causes of morbidity and mortality in the country. Malaria has remained a major public health problem in Nigeria. It accounts for over 60% outpatient visits and 30% hospital admissions in Nigeria. Over the past few weeks, Nigeria has witnessed an unprecedented malaria outbreak, especially in the northern part of the country. At least 5 out of 6 families in various neighborhoods are affected. Most medical centers, both private and public, are filled to the brim with affected patients, many of them requiring emergency attention, while quite a number resulted to death. The proportion of this upsurge, both in spread and intensity, is most worrisome.
Me, I'm not feeling fine because my body will shake anytime. Because I'm not getting money, because I not get work.
We are typhoid. And quite I've seen some Friday that I admitted.
Most all the people in that compound, they are sick. Malaria, typhoid. When they go to hospital, malaria, typhoid, and there's no money for their treatment.
Almost 3 times now she's living at the hospital. We also come yesterday night. She spent almost 3 days at home. She's not feeling well because we just came to the hospital yesterday night. She was starting vomiting.
She's sick now for the past 6 months with that malaria and the typhoid, and there is no how to do. We are managing it like that.
I only thank God and I thank God for the people I treat this hospital. Because if you know them, I cannot talk like this myself. But I just thank God. The only thing I always do it.
Some medical experts in Nigeria have attributed the recent malaria epidemic in the country to poor personal and environmental hygiene practiced by the public. Others' opinion differ.
It's a research that I guess everybody has to do. Because of the truth, we can have a family of 6 who we have people patronizing this very facility. Family of 6, 5, everybody malaria. That is a question we are also asking. It seems the thing has mutated to another thing. The malaria that we used to know before is not the malaria that, it's really coming up now.
The rainy season, in fact, is the major cause of the increase in the incidence of malaria currently in Nigeria, because you have more favorable conditions for the vectors to breed.
It's not longer obtainable. You go to the community, you see a house, there are issues on what do you call this, our gutter, filled up with a lot of rubbish. And so these are sources of this mosquito, or breeding ground for this mosquito.
When the mosquito comes, definitely one will be infected. That is the bite from the female Anopheles mosquito. When it bites you, you get infected. But when you are under the protection of a net, it will not have access to you.
At least 4 out of 6 siblings in most of the families in Kaduna State visited by Liberty News are affected with malaria, and these families live in dirty environments. They, however, lament the challenges they face getting adequate medical attention in the face of the current economic recession.
The sickness again. Almost everywhere. Every time. Last week I know how much I spent in buying drugs. Even me as I am now, I want to go and do my own test, because yesterday night I couldn't sleep well.
Actually, it's very hard, as you say, the country is in recession and things are hard for people. But definitely government have to do something with this outbreak of malaria and typhoid and other diseases. Because the kind of hardship people are in, people are looking for food, not even for medical attention. Because without having food, you cannot even do anything. So the process of having money to spend on hospital is not easy.
Because we have to buy medicine, even without food now, we still have to come to the hospital. Because the health is better, because health is wealth.
The money that I have is my people. There is one that provide the money for me. That's one I'm here. But the only thing I can say, I'm only thankful for my people.
So because me I don't get money, because I don't get work, when they say I want to get money for take the medicine. So make government to help me to send my help, my mom, my parents and my sister.
All of my sick?
Yeah.
Food, medicine, money, everything.
In that position, people are suffering because no matter how you went to the hospital, the doctor or the clinics told you should go and look for this medicine, where you get the money and get, that's the big key.
It would be recalled that the Kaduna State government had earlier announced that it has supplied free malaria drugs and treatment in various government hospitals in the state. Apparently concerned by these developments, Liberty News went around the medical facilities in the state to verify the claims. The crew discovered that only one medical facility, Yusuf Danso Memorial Hospital, was supplied with the said free drugs, thereby making the hospital overpopulated with patients at the mercy of few medical personnel.
It's very true, the governor was here himself. We got the supply of artesunate injection, which is the good drug for severe malaria. This hospital got about 2,800 doses of injection artesunate. Okay, we were asked to supply it free to anybody that comes to the hospital with malaria.
For this facility, we've not seen anything. Yes, so I cannot really say yes to that.
However, some of the patients affected with malaria say they are discouraged to visit government hospitals in the state for the free drugs because it is overpopulated and they stand the risk of losing their loved ones due to inadequate medical manpower therein.
I can't go to government hospital because if I take him to government hospital, because when I brought him here day before yesterday, he was fainting. If I go to government hospital, sometimes they will say they have 2 or 3 doctors, and that doctors are going to see only 10 patients. So maybe you go late or you didn't come early and your condition is critical. So they cannot be able to see you. They will select 10 patients. If you can die, you can only die there.
Or sometimes when you cross for the government, they will not take you as the maybe they know you. That's why I'm not focused on government.
When you go to the government hospital, they are full. The patients are full. Most of them are even lying down on the ground. There is no bed, there is no room. The doctors are even tired. Most of the doctors are tired. Some of the nurses are tired.
I go hospital to not want to give persons because I got that government hospital that use it because he says he's not good.
The masses, however, called on the state government to find an alternative means of distributing the malaria drugs to the affected patients in the state.
So I think government should do much more in this aspect of health sector, because if there is no health, I don't think people can even do anything. So I think government should do something much
to help us. Let God help the government so that they can hear the cry of the poor masses and come to our aid by helping us, even if it's to provide some drugs to door-by-door houses so that the poor masses can reach the poor masses. Because if they send it to hospitals, not all that can go there to get, not all that even know that this thing is existing somewhere.
People not get money, please help people.
Meanwhile, some of the medical personnel who spoke off camera to Liberty News also stressed the need for the state government to consult medical doctors in various hospitals in the state for appropriate malaria drugs prescription and supply, stressing that they are forced to treat patients with the drugs provided by the government when in most cases the drugs may not be the best for the patients. Naka Luke, Liberty News.